Well, hello, it's Bruce Williams again, and today is time for Growth Path Challenge number 64. Are you ready? I sure am. And slide number 1 is tissue from a pig. Can you give me a morphologic diagnosis and 3 possible causes? Okay, time's up. We're looking at the roof of the mouth, here, the ridges of the hard palate, and this structure right here is the very large palatine tonsil that pigs have. And it's a great place to sample and culture for a variety of viruses and some bacteria. The little white dots that we see are areas of necrosis, probably necrotic material that is accumulated in these large crypts that you can see the entrances or the ostia of. So the morphologic diagnosis is multifocal to coalescing, necrotizing tonsillitis, or multifocal tonsillar necrosis, and some great causes. Viruses that will cause necrosis in the tonsils, probably the most important is going to be classical swine fever, but you can also see this in young pigs with pseudorabies disease or suid herpes virus type 1, also known as Ojeski's disease in Europe. You can see it with porcine circovirus type 2 or the arterivirus that causes porcine reproductive and respiratory system, or PRRS. You can also see this with a couple of bacteria. Salmonella loves to hang out in the tonsils, and anthrax will also hang out in the tonsils. Lymphoma is probably a very remote possibility, usually would cause much larger nodules, maybe discoloration of the tonsil. So I don't think I would put that in my differential list for this particular lesion. But it's a great lesion, and I absolutely want you to think about classical swine fever, or as I learned it many years ago, hog cholera. Slide number 2 is tissue from a chicken. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We're looking at the kidney. On one side of a chicken, it has 3 lobes. Some people say that chickens have 6 kidneys. I think they have 2 and they have 3 lobes, but I'm not an anatomist. And what we're seeing is we are seeing an outline of every single tubule in this. Now, there's a couple possibilities here. The tubules are outlined. They are whitish. There are 2 possibilities here. One is that we have diffuse tubular necrosis. So this would be a diffuse renal tubular necrosis. And when you think about that, you want to think about one particular virus. It is a coronavirus, and it causes infectious bronchitis. And you're like, infectious bronchitis in the kidneys. Well, there is one nephrotropic strain, which is going to cause diffuse necrosis of the proximal convoluted tubules. Now, the other possibility is that we have a severe case of renal gout, which has not gotten to the point where it's become visceral, starts to precipitate on the outside of the kidney. Whenever you damage the tubules, you're going to have accumulation of urates. Urates are excreted through the kidney. That's the end product. And so when the proximal convoluted tubule is damaged, it accumulates there, and it never gets out of the kidney. So it's sort of difficult to tell necrosis from accumulation of urates and accompanying granulomatous inflammation. They do go hand in hand. So I want you to think about gout, very common in poultry, and every flock has some background level of gout, usually in treated flocks. There's always maybe a 1% because you're always going to have some animals that can't compete for water and they get dehydrated, they get some gout. And then I want you absolutely to think about infectious bronchitis in this particular case. And that's actually what this particular slide of is, an old slide back from the 60s, a case of infectious bronchitis affecting the kidneys of a chicken. Okay, slide number 3 is tissue from an ox. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We are looking at a section of the esophagus. You can tell as a muscular wall has a very thick white mucosa. And we're looking at these two little growths. They look like the end of little paintbrushes to me. And this is very classic for papillomavirus infection of the squamous mucosa of the GI tract. And this can be the result of bovine papillomavirus type 4, which is a goodie. And there are also reports that it can happen from bovine papillomavirus type 2. Papillomavirus type 2 generally affects the skin. It causes large fibropapillomas, which have both a mucosal or a epithelial proliferation and a proliferation of fibrovascular core. They're usually big, hefty neoplasms. But I learned this as bovine papillomavirus type 4. It's only recent that I've learned that bovine papillomavirus type 2 can also affect the upper GI tract. Slide number 4 is tissue from a dog. Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up on this one. And this is a tubular organ. Looks very congested. Maybe there's some necrosis and hemorrhage going on as well. It's very congested. And if you look at the wall, the lumen is sort of jaggedy, and the wall is extremely thick. And then when we look at this cross section, you can see that the intestinal wall should be very thin, and it is extremely thickened from the mucosa down to the muscular layers. This fibrosis extends transmurally through the wall into what looks like probably adjacent mesentery, or maybe just out into space. But it's a very irregular contour with a lot of fibrosis. When I see that in the gut of a dog, I'm not really thinking here about lymphoma. That could look like this, but it doesn't give you this sort of jaggedy appearance. There's a lot of fibrosis. So I'm going to be thinking of a number of type of fungi which affect the intestine of dogs. You can also see the intestine of horses. And one of the ones that we got to think about is going to be some of your dimorphic fungi, like histoplasma, blastomycosis, which not uncommonly affects the intestine, causes a lot of fibrosis. Coccidiomycosis might do that. The other possibility is some classic fungus-like organism. Zygomyces is a fungus. Whenever you think about zygomyces, you always also want to think about Pythium, which is a mesomycetozoan. And I lump those 3 together with another one that's been identified in dogs and cats, and that's Laginidium. And when you look at that, you see these sort of long, hyphal-like structures. Pythium is very characterized by these long, hyphal-like structures, which are surrounded by eosinophils. They don't stain very well. None of those 3 stain very well. And you get a lot of fibrosis. It's a chronic active infection. So we've got a bunch of different possibilities. So if you gave me any of the dimorphic fungi, with the exception of crypto, I'm not so crazy about that one. And then Zygomyces, Laginidium, or Pythiosis. Those are all good rule-outs for this particular appearance of the intestine in the dog. Here is slide number 5, and this is tissue from an ox. And can you give me a morphologic diagnosis and 3 possible causes? Okay, this one's going to be a little bit more complex, but this is we see that the anterior lobes of the lung are very depressed. There is fibrin exudation, which is very important, over this area. Oops, I went backwards. So in the caudal lobes, they are inflated to the point of hyperinflation. This animal obviously has been breathing very hard, trying to get its air in. And when cattle do that, they often will rupture some of the airways, and the air will get into the interlobular space. And this is sort of interlobular emphysema. And it basically is a nonspecific finding that essentially says this animal is breathing very hard at the end. Okay, so this is a case of shipping fever in an ox. And the reason I'm differentiating this from just simple viral infection is this exudation of fibrin. So many of these agents of shipping fever have endotoxins or various toxins which cause vascular damage, loss of protein-rich fluid into the tissue, which eventually you will have polymerization of the fibrin. Now, if we didn't have this, I may consider just simple viral infection. BRSV often has sort of a different look in the caudal lobes than the cranial lobes. The cranial lobes are atelectatic and compressed. The caudal lobes tend to be thick with interstitial ammonia, but it doesn't generally carry this amount of fibrin. Whenever I see this amount of fibrin, I'm thinking of classic shipping fever. And when I learned about shipping fever years and years ago, it was basically one agent, and that was Pasteurella hemolytica, which is now Mannheimia hemolytica. So many of the Pasteurellas have been renamed. We're going to talk about a couple in just a sec. And it was like shipping fever, Mannheimia, shipping fever, Mannheimia. But over the years, I've expanded that one agent to about 6, which can give you this particular look. One of the first ones I added to the list was Mycoplasma mycoides, variant mycoides, small colony. This is a disease which has been eradicated from the U.S., but it's seen in other parts of the world. It's contagious bovine pleural pneumonia. And this particular agent can look exactly like Mannheimia, down to the histologic section where you see oat cells, and you see this tremendous outpouring of fibrin into the alveoli, into the interstitium, and to the overlying pleura. So the really, really angry looking ones with a lot of fibrin, Pasteurella or Mannheimia hemolytica, and Mycoplasma mycoides small colony. Okay, so now we're going to expand some of these Pasteurellas. Okay, Pasteurella multocida. Yes, it can cause a lesion that looks like this. You tend not to have, and this was a great little bit of information I got years ago from my good friend Donald O'Toole, and it's held up. The one thing that sort of clues you in Pasteurella multocida is you have a lot of devastation, but if you look in the airway epithelium, for some reason, even though the epithelium is, or the lumen is full of neutrophils, seems to be intact, whereas the rest of these, you have loss of the epithelium. With multocida, you also don't get the oat cells and the large areas of infarction, which are bounded by cell debris that you get in the two that I've already mentioned, the worst of them, Mycoplasma mycoides small colony and Mannheimia hemolytica. Well, we're talking about Mycoplasma. I'm going to mention Mycoplasma bovis, which can give you a similar look. It often looks a little bit different because of the possibility of, it really likes airways. You get a lot of bronchiectasis. Sometimes when you cut through these, you will see that the airways look like little golf balls because they're so full of exudate and they're so swollen. But I got to add Mycoplasma bovis to this, a disease that a couple of years ago was emerging. Now it's spread across Canada and the US, and everybody sees it now. So I'm going to add Mycoplasma. So now we have 4. I've got 2 more. There used to be a Pasteurella Biebersteinia, and now it is has been split out and is now called Biebersteinia triolosi. It used to be Pasteurella triolosi. Sorry, I had that wrong. I never really saw it a lot, and it's still probably the least common. And so this Pasteurella has been renamed to Biebersteinia triolosi. That's not for Justin Bieber. That is for a famous microbiologist named Bieberstein. And then I said I was going to have a 6th. The sixth one is Histophilus somni. It doesn't tend to give you that much fibrin, but certainly we've seen the pattern of disease change in feedlots from what used to be years ago thrombotic encephalopathy, a lot of neurologic lesions. Now we see more pneumonia. That might be the most common, and it can look this bad. With Histophilus, you have to think about a number of different syndromes, including the thrombotic encephalopathy, pneumonia, also myocarditis, abscessation, especially of the papillary muscles. You want to think about reproductive damage and also polyarthritis. So that's sort of a five-headed monster, Histophilus somni. So I only asked you for 3, I think, and I gave you 6. So you got to always remember Mannheimia, hemolytica, mycoplasma, mycoides, mycoides small colony. Then I've given you a couple of others: Histophilus somni, Pastorella, Multocida, Mycoplasma bovis, and then finally Biberstenia triolosi. All can give you shipping fever-like lesions. And we're done with that one. Here's a great one, and this is tissue from a pig. Can you give me a pathogenesis of this lesion? Okay, time's up. I hope you stop this a little bit and you spend some time thinking about how this lesion comes to pass. We are looking at the rectum of a pig. A little bit of melanosis here, don't worry about that. And there is a rectal stricture. And when you construct, if you're taking one of these certification exams and you're constructing a nice pathogenesis, which is the way that the college really gets to mine what you know about this more than just asking for a cause. You need to start with a causative agent and then work your way through a series of intermediate steps which are important to get to the lesion. We know this lesion is rectal stricture. The wall of the rectum here is very thickened by fibrosis. You have a lot of hemorrhage here. The animal's been straining to pass stool, so there's ulceration. There is hemorrhage. So how do we get to this? Well, this is a classic lesion of rectal stricture, which is the result of infection by Salmonella typhimurium, a non-host adapted salmonella which will infect a wide range of species. There are host adapted salmonella in pigs, which if you get a host adapted one, it causes more of a septicemia. So Salmonella cholera suis and Salmonella typhus, you will see lesions throughout the body. When you get to Salmonella typhimurium, which is not host adapted for pigs, that will cause a necrotizing enterocolitis and proctitis in pigs. Now, so we start out with ulceration and healing of this ulcer. The animal didn't die. And so we have this healing lesion of enterocolitis, and it heals pretty well, except right here in the rectum. And there is a field right here, a vascular field, where the caudal pudendal artery coming from the anterior of the animal and the cranial hemorrhoidal artery, they don't really meet very well. And there's an area which is not covered very well, and when you have this area of poor vascularity, you tend to get a lot of fibrosis there, and that's exactly what happens here. So my pathogenesis for this is enteric salmonella infection. I'm going to put a little arrow there, okay? Ulceration of the rectum. Next step, poor coverage by cranial, hemorrhoidal, and caudal pudendal artery. Next step, fibrosis. Next step, rectal stricture. So it's a great story. It's a classic lesion, and no more I can say about it. Great picture, though. This is tissue from a rabbit. Can you name the agent? Okay, time's up. we are looking at the outside of the cecum of this rabbit. There's not much going on in this rabbit except for these sort of translucent cysticerci, which are attached to the serosa of the cecum. They're not really hurting anybody. And this is a agent which is known as Cysticercus pisiformis. The adult will be in a cat. It will be Tinea pisiformis. So Cysticercus pisiformis in the rabbit. Oops, we went flying through a couple. Okay, slide number 8 is tissue from a dog. Can you give me a morphologic diagnosis and name the condition? Okay, time's up on this one. This is a section probably from the pressure point of an animal, maybe the elbow or something like that. And it's probably a young animal, or it might be an area where there was surgery before. There's been trauma here. And some animals, particularly large breeds, will put down a lot of calcium in and around this area. This is a form of dystrophic calcification. And when you get this much calcium, you often have a granulomatous response. So these are lakes of mineral surrounded by multinucleated giant cells. And the condition is known as calcinosis circumscripta. Don't confuse this with calcinosis cutis, which is another form of dystrophic calcification, which is associated with hypertrophic corticism in the dog. This is a condition which is usually seen in younger dogs. These areas of mineralization and inflammation tend to enlarge as the animal grows, but when the physes close, often these close. You can see them in areas of trauma, areas where there's been previous surgery and there's suture material in there. You can even see it in the tongue, which is an odd lesion. But like I said, they tend to, oh, Siri, I don't need your help on this one. So these tend to be seen usually in young dogs, and they will persist over time. It's not like when the physes close, they go away. They just stop increasing in size as well. And I'm going to go back because I realized that I misspoke on Cysticercus pisiformis. The definitive host is not a cat. It is a dog on this one. So sorry about that. Calcinosis circumscripta, we only have 2 left. This is a great picture. This is from a cat. Can you name the condition and give me a cause? Okay, so time's up. We shaved down this cat. We can see around the mammary glands, there are variably sized lumps. Now, in cats, if you said that this was mammary neoplasia, I can't give you full credit on this. But remember, in cats, if you see this many lumps, and the vast majority, maybe 90, 95% of cat mammary tumors are carcinomas. They're often ulcerated. You'll see the big ulcers here. I really probably wouldn't put this in the camp of mammary carcinoma. What this particular condition is fibroepithelial hyperplasia of the mammary gland. This is a great paper that was written back in the 90s. It's in VetPath. You should be familiar with this. And this is a condition that may be seen in feral cats, but it's often seen in cats that have been administered synthetic progestins. Back when I was in practice, there was a drug called Ovaban. It was megestrol acetate. It was a synthetic progestin, and it was great for everything. And you would prescribe it if the cats were acting funny, or they were peeing around the house, or whatever. And it would just quiet them down great. The only problem is that in female cats, it would cause fibroepithelial hyperplasia of the mammary gland, and it often would cause diabetes as well. So those were, neither of them liked them. And the animals would get these big swellings on the mammary gland. And if you look at them, it is some proliferating mammary glands, and then surrounding them was a lot of loosely arranged fibrous connective tissue. So fibroepithelial hyperplasia of the mammary gland. You can see this in young feral cats as well. Maybe they're going through some sort of disruption of the estrous cycle where they have an imbalance of estrogen or progestin. But it is not uncommonly caused if you give domestic cats synthetic progesterone. Okay, and slide number 10 is tissue from a budgerigar or a parakeet, whichever you prefer. And can you give me a morphologic diagnosis? Okay, time's up. This is a cutaneous xanthoma. This is not a tumor, sounds like a tumor, but it's really just diffuse xanthogranulomatosis inflammation, which means it's granulomatous inflammation with a tremendous amount of fat in it. You have large multinucleated cells, which often have a lot of fat bubbles. You may see acicular clefts due to cholesterol. Nobody knows what causes this. You can see it around the wings. It's often associated with feather-picking birds, according to Dr. Mike Garner. He thinks maybe the trauma to the skin of the feather-picking will incite this, and it becomes a vicious cycle. So this is a cutaneous xanthoma. Xanthomas used to be a thing in poultry back in the 60s and 70s. It was thought that it was due to a high level of hydrocarbons in the feed. And what you see, these little dents here, same thing as you see in poultry. This is where feathers used to be. These are the follicles. The feathers are gone. They've fallen out or they've been picked out by the bird, and you see this opening. Xanthomas or xanthogranulomatosis inflammation is a disease primarily of the tissue between follicles rather than a follicular disease itself. Well, that brings us to the end of Gross Bath Challenge number 64. Hey, I want to thank you for spending some time with me today. I know it's tough on all of us being indoors, but we are doing what is right, and we are making it easier for the healthcare workers out there. We are keeping them safe. We are keeping our families and even strangers safe. So let's all try and pass the time as best we can. We are changing the way education is done. I'm not saying this is, but as I look at what the foundation is doing, we are programming more tele education. I really don't think that that's going to go away when all this is said and done. So I hope you're enjoying these little Gross Bath challenges, and you'll come back often to wherever you get them from, whether it's the JPC Video Library, whether it is the Foundation's YouTube channel or our Facebook page. And I hope to see you again tomorrow.